I just let a bunch of needles puncture my face. Not one, not two, but thousands. Thousands of times a minute. And I would do it again. Hey, my name's Alex. I'm a physician assistant in aesthetic medicine, and today we're going to break down the treatment of microneedling. We're going to go over what it is, what it does, how it feels, and most importantly, is it worth it? So, I'm going to step you through my own experience so we can cover the treatment, the recovery process, and what you can expect. Microneedling is not a medieval torture device, and it won't leave you leaving the office like Deadpool, at least not for long. If you've ever been curious but hesitant about this video should answer most of your questions. So, no filters, no hype, just a walkthrough. Let's get into it. Let's start with what it feels like to actually have the microneedling procedure performed on you. And particularly for me, it's an important aspect because I'm a guy and we aren't very pain tolerant. And I'm probably the epitome of that. Before the procedure starts, we do apply some topical anesthetic, so some numbing cream. And you'll usually numb for around 15 to 20 minutes. And then we'll start with the procedure. Now, initially you can expect to feel some buzzing or pressure on the skin, and sometimes that's as far as it goes. I've treated patients who have felt anywhere from a relaxing sensation or no sensation at all to mild discomfort, sometimes moderate. For me, I'm kind of in the middle. Now, treating some areas of the face can be more sensitive than others, particularly forehead and bony prominences, think cheekbones and jawline, but overall, well tolerated. Personally, I wouldn't call it relaxing, but I've experienced worse at the dentist. After treatment, you can expect to be red, and that can be anywhere from a light sunburn kind of red to a pretty drastic cherry red, but that usually subsides pretty quickly. It all depends on how reactive your skin is as an individual, or how aggressive treatment is. All right, now let's talk about the star of the show and the tool behind the procedure, the microneedling device. At our practice, we use the SkinPen Device, and each one comes with a separate, clean tip. Now that's important because it is different from home derma rollers where you won't have a fresh tip every time. We don't have to worry about any cleaning, sterilization, everything's pristine, and each needle is sharp when we do use it, which is vital so that we don't provide any extra trauma than what we are trying to achieve. One of the additional key differences between a pen such as this and a home device is that derma rollers typically roll, whereas a microneedling device for professional use is going to be a strict vertical motion, in and out, with no side-to-side tearing of the skin. Furthermore, the use of these tips allows us to control the depth of each puncture. I have anywhere between 0.25 millimeters to 2.5 millimeters. So the treatment is very customizable for your personal comfort and your skin health. And when it comes to the SkinPen microneedling device, that motor runs at around 7,000 RPMs, which means the tip of this cartridge oscillates in a vertical motion in and out of the skin over 100 times per second. But what does that mean for treatment? That means we are able to treat skin with around 1 million microchannels per 10 minutes. And when a treatment session lasts 20 minutes, you're getting around 2 million microchannels formed. Isn't that crazy? You need a super professional slow motion camera to capture that kind of speed. Lastly, like I said, we use the SkinPen Device, which was the first FDA-cleared microneedling device for professional use. It has outstanding reviews. We've had a lot of success with it, and our clients really love it. So yeah, definitely a little bit of a step up from those Amazon derma rollers. But just like my 2-year-old, we always have to ask, why? 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 Why poke so many holes in your face? Why do that? Well, it all boils down to controlled dermal injury. And what we're trying to do is have your skin reinvent itself from the inside out. We want to provide a controlled depth injury and a controlled severity injury so that your skin is tricked into rebuilding itself. It's going to promote collagen production, new vessel formation, essentially birthing a new coat of skin. Sometimes the skin gets a little lazy, gets a little tired. If you're not stressing it, it gets too comfortable. Like if you've been on the couch for too long, you're gonna get too comfortable. But we need to get up, we need to exercise. We need to lift some weights, we need to instigate some repair process, and therefore building of new tissue so that we can look better. And ultimately, your skin performs a little bit better too. That's an added perk. So in providing this controlled injury, we send our skin into a healing phase. After the injury is complete, you're gonna look a little burnt, you're gonna look red, you're gonna feel sunburnt, the skin's gonna be a little bit more sensitive than usual. But this is the inflammatory phase. It's gonna call all of your healing cells to action. It's gonna say, come help me. I have been in a battle. I have been injured. And it's gonna say, hey immune cells, hey growth factors, hey platelets, come on, I need your help. And once it has all the helpful cells there, you're gonna enter the proliferative phase, where it's gonna start laying down new collagen to strengthen that controlled injury or that wound. So you're gonna get new collagen, you're gonna get new elastin, and then finally we have the remodeling phase, where it takes that temporary collagen and it replaces it with more structural, sturdy collagen. Now again, why would we wanna do that? It's going to cause some skin turnover. So you're gonna shed some of the upper layer of skin, which has some pigmentation or some melanin in it, so it often leads to a brighter complexion. Deeper down, you'll have that dermis. When injury is caused there, that's where most of the collagen is built. It's gonna break up scar tissue and build up some of that skin thickness, so it is great for acne scarring. The increase in collagen production is going to, again, thicken that skin. It's going to fill in some of the fine lines and wrinkles that you have. So it's going to smooth out the surface of the skin from underneath by making it more plump and more durable. When you smile or when you squint, you might see some crepey skin because it's thin skin. It's weak. It's like tissue paper. If you touch tissue paper, ooh, you know it because it's creased and it's never going to go back to normal. But if you bend a thicker stock paper, it's got some durability to it. It's got some bend. It's got some flexibility. And when you let go, it flattens back out without a crease. So in all, microneedling is great to give you a brand new skin. It's going to help with fine lines. It's going to help with deep lines. It's going to help with some pigmentation. It's going to help with some scarring. It's going to help with some durability and some firmness. But Alex, what's the difference between microneedling and the other modalities, such as lasers or chemical peels? Well, the difference being that microneedling is solely going to be a mechanical injury. With lasers, you're going to encounter heat and depth variability. With chemical peels, the same. You're going to deal with chemical burns and depth variability. With microneedling, we do have a very controllable depth, and it is a simple mechanical injury. And for some skin types, that's going to be better. So when we poke you, we're not just poking for fun. It's a very guided micro trauma, and your skin's going to know exactly what to do with it. But let's bring it back home to you individually and answer the question on who is a great candidate. Well, great candidates would be people that are looking for improvement in their large pores, fine lines, a more refreshed look, or if they want to start fighting the aging process either at a young or an older age. And unlike a lot of other treatments, such as most chemical peels or most lasers, the SkinPen and microneedling is going to be relatively safe for all skin Fitzpatrick levels. Now, who is not a great candidate? You may not be a great candidate if you are prone to keloid scarring, and that's something that we would definitely want to discuss first to weigh risks and benefits. Other people that might not be a great candidate would be people with health conditions that impede the healing process, whether that be bleeding disorders or uncontrolled diabetes. If that's the case, we may want to time it out appropriately and wait until those conditions are controlled. Even people with a lot of active acne or active skin infections are obviously not going to be great candidates for the treatment at that time. But I don't want to seem like I'm just saying no, 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 no. The good news is we can usually work around everything as long as we know about it ahead of time. We may need to schedule some things, but that's typically not a problem. To summarize, microneedling is safe and always beneficial if done at the right time on the right person. And we are here to help you figure that out. I'd say the second biggest concern for most people is they want to know what they're going to look like afterwards and what's the recovery process. So let's go through it. Immediately after treatment, you're going to look like you have a sunburn. You're going to be visibly red. And this is going to be anywhere from a mild to moderate erythema or redness. And that's going to last for about 24 hours, and then it's going to start lightening up. And by day 1 and 2 afterwards, it's just going to be a light and a subtle redness. In fact, if you check my face out right now, this is the end of day 2 after my procedure. So it does not have to look bad at all. Now, during the first 24 hours, and especially immediately after treatment, you might feel a little warmth, you might feel a little uncomfortable, and your skin is probably going to be sensitive. That's why I always warn patients, take it easy in the shower. Don't look directly up at the shower head because it's going to be a little sensitive. After that first day, some people do encounter a mild bit of swelling, but this is not everybody. And during the recovery process of about 4, maybe 5 days in all, the tail end of the recovery, some people might find that they have some dryness and flaking. Not everybody, but that is totally normal as the top layer of skin is renewed. It's got to shed the old, bring in the new. And during this vulnerable time for your skin, what are you supposed to do? You can't be doing any strenuous activities, so no lifting, no sports, and refrain from anything that would cause facial flushing or further redness. That's going to be things like hot showers or saunas, as we want to keep those skin cells as stable as possible. And particularly for the first 24 hours, while those channels are still open, you're going to want to protect them. So keeping the face very clean, refraining from sweating, because I don't want any bacteria to get in there. Now, especially because your skin is vulnerable, it's going to be imperative that you baby it. It's going to need to be kept moist with a lot of moisturizer or a hydrator and protected against the sun. So SPF sunscreen is non-negotiable. This is not only going to improve your recovery experience, it's going to improve your results, and it's going to protect you against complications such as post-inflammatory hyperpigmentation. So let's talk results, because microneedling is one of those treatments that definitely gets better over time. Short-term results, in the first 1 to 2 weeks, you can expect your skin to feel smoother, more even, and have a little bit of a plumpness to it. And this is going to be due to the initial skin cell turnover and the initial boost in hydration and circulation. But long-term results, that's when we're talking about new elastin and new collagen. That grows over 4 to 12 weeks. So even months out from your treatment, in the background, that collagen is still being produced. Now, most people do find a better improvement with a series of 3, which is what we typically recommend. So a series of 3 treatments, and those are typically spaced about 4 to 6 weeks apart. If your goal in microneedling treatments is to address more deeper or more complex skin concerns, such as acne scarring, you can expect a little bit more than 3 treatments. And we're talking about possibly 4 to 6, sometimes even more. After your initial series of treatments, it is recommended to do at least 1 or 3 per year just to keep your skin in that regeneration mode. The key is to think of microneedling as a journey or a process. Your skin didn't get to where it is today overnight, so it's going to take a little bit longer to reverse that damage that has been done. It may seem daunting, but when you stick with it, it's definitely worth it. Before we end with some rapid fire questions, thanks for sticking around. Hopefully you learned a little something. And if you do have any additional questions, never feel afraid to book a consultation with a provider. And with that, I will turn it over. All right, thank you all for attending. I'd like to open it up for some questions from the Associated Press. We are only answering questions pertaining to microneedling. So let's get started. Yes, Sheldon.
Does microneedling hurt?
No, not with the proper topical anesthetic. I'd say maybe you'll feel some pressure and some vibration. At most, a mild discomfort. Next question, please. Mr. Todd Sweeney.
Will I bleed everywhere?
That's a good question. Sometimes we do have some variability in some bleeding. At most, you'll get some pinpoint bleeding. Even then, it might not cause some bruising. Even if it does, probably like a day or two you're looking at. Next question, please. Yes, back to office employee.
Is there downtime?
That's a question we get a lot. But like I said before, you're probably looking at 1 to 2 days of some light erythema or some redness. Think like a sunburn kind of look. And day 4 or 5, that redness kind of resolves and maybe you're left with some dry or flaky skin. Mild at most. Next question. Yes, stay-at-home employee. Can I just do it at home? I get it a lot. I get the question a lot, but when we're talking professional treatments versus at-home treatments, at-home derma rollers likely don't go deep enough to stimulate a good collagen stimulation effect. With at-home devices, do you really want to chance further trauma and infection? So I'd make a point to come in for your professional treatments. Next question. Yeah, in the front, Piglet.
Will it thin my skin over time?
Nope. Well, it will. It will if you don't come in for your treatments. But the microneedling procedure is proven to thicken the dermis and thicken the skin by increasing your collagen production and content in the skin. Next question. Yeah, tough guy.
Is it just for your face?
No. The face is by far the most popular area of treatment for us, but we also do necks and chests, even sometimes the scalp for some hair restoration. All right, guys. Thank you all for your time. That's all the time I have. See you at the next one.